Good afternoon, everybody. My name is Alan Witchy. I'm the president and CEO here at the Damien Center. Thanks for joining us today for our Facebook Live. I'm very excited about the topic we're talking about today. It's hepatitis C and the connection to HIV. I'm joined by two wonderful guests today. I'm going to let them introduce themselves. Carrie, I'll let you introduce yourself first.
Hi, I'm Carrie O'Brien. I am the Harm Reduction Program Manager here at Damien.
And Madison.
Hi, I'm Madison Weitraub. I am the Program Manager of the Safe Syringe Access and Support Program at Marion County Public Health Department.
Great. Well, we're here today to talk a little bit about hepatitis C, the connection to HIV, harm reduction programs, needle exchange programs, kind of overarching things. So some people who might be joining us might not really be aware of the sort of severity of the hepatitis C epidemic here in central Indiana, Marion County in specific. So I know, Madison, you're an employee of the Marion County Public Health Department, if I can say that, and you probably have some information and data. I know from our side, we always look at it that amongst the HIV cases, we know about 10% of those are new cases are known injection drug users, and of those, over half of them usually have Hep C in conjunction with HIV. And we know our Hep C rates here locally are very high compared to national levels. But what can you tell us about Hep C?
Yeah, so every year in Marion County, we get over 1,000 cases that come in of hepatitis C.
Wow, that is so many more than you might normally think.
It is, and actually for every case of hepatitis C that's diagnosed, there are about 14 that go undiagnosed.
Wow.
We look at those cases and try to determine how frequent or how recently that person was infected, depending on if they have symptoms, if they have a history of previous testing for hepatitis C. And usually each year we're having about 70 to 80 cases that we know were infected within the past 6 months, and we call that acute hepatitis C. Of those new cases, consistently 85% or more are related to injection drug use, and we know that people who inject drugs are 50 to 80% of them will actually acquire hepatitis C during the first 5 years of their drug use.
Wow, that is an extraordinarily high number. You said over like 80%? Did you, or
50 to 80%.
50 to 80%.
Yes.
So that's quite a number. And so tell us maybe a little bit more specifically about the program that you run.
Yeah, so based on the amount of hepatitis C related to injection drug use in Marion County, we launched the Safe Syringe Access and Support Program, which is a syringe services program. It's harm reduction oriented, where we're providing sterile needles and other harm reduction supplies to people who inject drugs, so we can get that number down. Hepatitis C is just kind of the perfect virus to spread through injection drug use. It only takes a very microscopic amount of blood. So it's important not only that people have sterile syringes and needles, but also sterile cookers, cotton to filter their drug with, sterile water so that they can avoid bacterial infections. And so by doing that, we really hope that we can curtail an epidemic of hepatitis C here. We know in Scott County, Indiana, that the hepatitis C numbers were rising steadily prior to their HIV outbreak. And we would like to keep the 10% at 10% or lower of new HIV cases here.
Yeah, well, that is really exciting. And you have a sort of a truck that you, mobile sort of clinic that you get to drive around, right?
Yes, and I always say that's the scariest part of the program, that there are people like me driving this huge box truck around. But we provide our services mobily. We actually come here to the Damien Center. We've been coming to you guys since we started 2 years ago, and it's actually a very happening place right now.
Yeah, and you know, the most exciting thing about what you were doing is we were seeing great success with your program, and that inspired us to think about how we should step into this role and what can we play, not to in any means compete with you, but help supplement the need, because as you said, there's a very high need. And Carrie is the new program manager over our harm reduction area. Tell us a little bit about kind of what is Damien doing on the harm reduction stuff?
A lot of different things. Right now, we are currently offering non-syringe harm reduction supplies. So like Madison was talking about, the sterile cookers and cottons and the sterile water. We're distributing all of that. A lot of times we're right alongside their mobile SSP unit. We are offering testing out in the community for the folks who are accessing SSP services. And folks that come here. We offer any supply that they would need to do injection drug use, smoking, snorting, anything to be a little bit safer and to try to reduce some of those risks of transmitting hepatitis C or HIV.
So, what do you all think about this? It's kind of hard for some people to understand what harm reduction means. And why is it beneficial for the community to do harm reduction programs? Carrie, why do you think?
Harm reduction, we provide a safe space for people who are using drugs or any substances. We provide materials, we provide information, we provide the support. We have a peer recovery coach that will work with folks and possibly whatever goal they have, whether it's complete abstinence, whether it's to reduce usage or just switch their method of usage. We recognize any positive change. We support them in any way we can. We act as their cheerleaders, we act as their support or their shoulder to cry on if they're having a bad day. We can help link these folks to services that maybe they didn't know about or that aren't easily accessed.
Great, thank you. What do you see amongst, you've been at this a little bit longer, what do you see as the positive outcomes for the clients that you see in your program?
So, I mean, it's slow going because it takes time for people to really embrace change in their lives, but it's been really amazing. I mean, like you said, any positive change. And we've had participants that have come and they have their first job in a long time and they're so excited, or they just got a car for the first time in forever and they're so excited to show it off. We have a participant who has set goals towards being able to be a coach at a little league, soccer tournament, things like that, that really bring meaning to people's lives. I really like to think of us as the cool aunt of the substance use spectrum, right? So you have your dad who is criminal justice and they're gonna whoop your butt if you step out of line. And then you have treatment providers, so like medication assisted treatment or Dove House, and that's like the maternal mother that is really warm and they're trying to, get you started on the right foot. And then the cool aunt is just here to support you. Whatever you need, we're here for you. We're just gonna make sure that you're okay and you're safe in the meantime. And
it's important because harm reduction is based in science and evidence that it's successful, right? So this isn't just helping somebody have a space to use drugs. This is based on actual evidence that shows that it reduces crime in neighborhoods, it reduces infections of other diseases, it actually helps more people to get into treatment through these programs. And what do you say when you might have a critic who's maybe concerned about what your program maybe negatively would add to the community?
Yeah, so syringe service programs have been operating in the United States for over 30 years. There's been so much research done on them that you just really, if you look at the research, you can't argue with it. We know that people who participate in the programs reduce their syringe sharing and reuse by at least 80%, if not more. That neighborhoods where syringe services operate see a decrease or no increase in crime. That syringe litter in the community decreases substantially because for the first time people have a safe place to dispose of their syringes. And I think that the greatest argument for any critic is just the cost, that for every $1 spent on syringe services, up to $7.58 is saved in HIV treatment costs alone, not to mention the treatment saved in hepatitis C treatment, which is what we're here about today.
Right.
Yeah.
I mean, that's sort of extraordinary, isn't it? That this sort of investment into a program like this can lead to not just a small savings, but dramatic savings over time, thousands and thousands and thousands of hundreds of thousands of dollars for a community. And we all know there's lots of other issues that we could spend that money on to make the community a better place, right? Carrie, what are you going to be doing with your team related to hepatitis C? We just got a new position. What's that role going to be doing?
Sure, it's super exciting. Damien Cares is actually going to begin treating folks infected with hepatitis C that aren't living with HIV or on PrEP. So,
and that's a new thing for us, right?
Brand
Because
new.
Traditionally, you could get treatment for hepatitis C if you were living with HIV or you were on PrEP and you were accessing medical care here. And now, for the first time, we're sort of expanding to a new kind of client, which is exciting.
And to support our medical team, the harm reduction team has added a health navigator, and they will be working with the folks we've identified through testing with SSP, through our testing department, who's now doing the rapid HCV tests. We will be working with those folks to get them into care, to get them insured, to link them with the treatment and the cure.
What are some of the barriers you either are currently seeing or you expect to see with the patients that will come in through that program?
General lack of knowledge of a lot of the folks don't realize that hepatitis C can be fairly easy to treat, and then with that treatment comes a relatively quick cure in 8 to 12 weeks. If they're adherent to their medication, labs are going well, everything's going good. Definitely, I'm a social worker, not a medical provider, so on my end, it looks really easy to treat. But in 8 to 12 weeks, these folks can be cured.
Yeah, I mean, that's really extraordinary because there was a time when you could get hepatitis C and there was no treatment. And I think that's still like a misconception out there in the community. A lot of people still think there's no cure for it. Do you find that to be the case too?
Absolutely, because I mean, it's been so recent. When I started working at the health department, it was still the interferon treatment that was really hit or miss on if it was gonna take care of your hepatitis C or not. The new medications since about 2015 are 95% effective at eliminating the virus.
So great, 95%. That is amazing.
Yes. And I think a misconception when it comes to the treatment, though, while it is a treatment for your current infection, you can always get reinfected for hepatitis C. So it's important to take care of yourself, to continue participating in a syringe services program or other harm reduction program to reduce that risk.
Yeah, I think that's a really critical thing to remember to focus on, that even though somebody has come in and gotten their treatment and it has been cured of hep C, it doesn't mean that they leave the program. They could actually stay in the harm reduction program on an ongoing basis because they may have ongoing needs that help keep them safe, right?
Absolutely.
Yeah. Do you do you find that it is hard sometimes to find places that will treat patients, or find it's hard to get patients engaged in medical care?
It is, because there are, again, a lot of misconceptions around hepatitis C treatment, who's eligible for it. It doesn't matter if you're using substances, if you're using alcohol, you are eligible for hepatitis C treatment, even on Medicaid. And there are a lot of providers that are still operating under a thought that was, 10 years ago, where, people that are using drugs or using alcohol aren't quite ready for treatment, and that's just not true.
Right.
Everybody deserves to get that treatment. And moreover, there's just a lack of providers to do it. The ones that are capable of prescribing the treatment are just completely overwhelmed with patients. So it's so exciting that you guys are adding another place to do that.
Good. Yeah. Well, we're excited. I think the thing that we realized for us, this is about, like if we're sort of addressing the HIV epidemic upstream, trying to prevent new cases, this was one of the most important things for us to do. It was because we know, as you said, like injection drug users have a very high tendency to get hep C, and we know that that is a very high risk to then acquire HIV next. And so this is really a critical piece about stepping upstream in the HIV epidemic and trying to stop the new cases from coming into our community. Yeah. So how will you see, Carrie, like the HIV work, HIV prevention work, overlapping with this kind of work that we're doing on hepatitis C?
Sure. As far as HIV prevention, we can get folks in that get a rapid result or positive for HCV, get them in, get them engaged in care, possibly on PrEP.
Yeah.
Connected with harm reduction supplies, which could also be just as simple as condoms.
Right.
And educating more, really trying to help increase some health literacy amongst different populations that we haven't really been reaching out to in the past.
So tell us about that. You mentioned sort of rapid hepatitis C testing. So how long does it take for someone to get their test results?
So our testing center has the 20-minute rapid antibody test, and that will let us know if they have ever had a hepatitis C infection. And then we will have to send off and draw blood for a confirmatory test to actually test to make sure that there is a current infection, because some folks can actually clear hep C without even realizing it.
Huh?
So
now tell us, like, how does that work? Do you know, like, how does that work? That sounds like really interesting. So you can sort of get your body can fight off the infection in some ways, right?
It's not common. Those are kind of superhuman people. So
Yeah.
about 75% of people that become infected with hepatitis C are going to have a chronic lifelong infection unless they get the treatment.
Right.
But your body is capable. Even if you do clear the virus, though, you're always going to be positive for that antibody test, which is why that's our screening tool.
Yeah. You also do that, the rapid test in your mobile van, right?
Yes, we do. Yeah, we have a tester from Eskenazi Emergency Department that is just absolutely wonderful that comes out and helps us with that.
That's good. And exciting news for us is not just this new case manager, but we are going to be having a mobile unit as well, correct,
We
Carrie?
are,
So
yes.
tell us about that piece of the program.
We were lucky enough to be able to get a giant 27-foot RV that we are getting customized to meet our needs. We will be sharing that in the hold prevention department. So we'll be doing a lot of outreach and be able to go to communities that we haven't been able to before. And it's gonna be super pretty, super fancy. So within the next couple months, it'll be up and ready to go. And we will eventually, when we start our SSP, we will be distributing supplies out of that as well.
So, I mean, that's exciting news. I mean, and that will be kind of a sort of a game changer around it. Largely, people had to sort of come to the site, or we had sort of outreach, people who would go out to the community, but we didn't have sort of the ability to mobily go places and do more, complex things like rapid Hep C testing and provide other kinds of care, which we could maybe do out of that van now. How long was it?
27 feet.
Foot. Okay. Are you comfortable driving that?
No.
I am not either. So I just want to. I said to put it out. Do you drive yours?
I do, and I'm very nervous about it every time.
How long is your van?
It's I don't know. I think it's probably 27 feet. It's the longest you can drive without a CDL license.
Yes, I think that's what we
Yeah.
got too. Yes, but it does make a difference, right? I mean, like having that mobile van, like how does that impact your program versus if you didn't have it?
It's incredible the space that people are comfortable with. So our mobile unit has been a very popular place for our participants, and we've opened up a couple different storefront locations over the past 2 years, and it's been really difficult to get people to go to them. I think part of it might be the stigma associated with walking into a clinic at times.
Right.
And the van being accessible to our clients is so important as well. So about 2/3 of our clients are experiencing transient living situations, homelessness, and are usually on foot or on bike. So being able to go to a place that's easily accessible to them is just super important to be able to meet their needs.
So and you said about 2/3 are sort of in housing unstable.
Yes.
And so what happens if somebody is looking for help with housing, how do you address an issue like that?
So we have a social work department at the health department that we're able to refer our clients to.
That's great.
We also, in the meantime, have CHIP's handbook,
Right.
which is so useful.
Yes.
But
And CHIP is the Coalition for Homelessness
Yes,
Intervention and
thank
Prevention. I previously worked there, so I know that very well. Yes, yeah. But it's a great reference to how to refer people who are experiencing housing instability or homelessness and where options are. And one of those options is actually here at Damien Center.
Yeah.
And so, how do you see maybe finding ways to connect to our existing programs through your harm reduction and things like food and housing and other things outside of the prevention area?
Because of the tricky funding, we have to get creative. And if our folks that are coming in for the Hep C health navigation aren't also living with HIV, we have to get extra creative.
Yeah.
There aren't as many resources available for hepatitis C in the city and nationwide. So we are working with other community partners to get folks engaged with services that are going to suit them as best as we can possibly find.
And it's also good to note that we have been doing active fundraising, so we have funding, and we can actually provide some food and some housing assistance sometimes to people because there are people who want to fund that. So if you're listening to this and you want to fund it, you can always make donations directly to help that. And so it is really important that we think about this as a program that we integrate into the whole organization, and that means we have to look at all of those other services and say, how can we better engage people with that? And one of the things that helps us fund that is we opened our Damien Pharmacy earlier this year, which is really exciting, and that helps generate revenue to be able to support kinds of programs that we otherwise wouldn't be able to do. So it's really nice. That's been a way to help. That then we will be able to provide food
Absolutely.
and some other services to groups that come in that are in the prevention area that we traditionally didn't have funding for, which is really nice. Yeah. So if you were to give advice to somebody who's kind of interested in maybe harm reduction services, they're nervous, they don't quite know what to do, what would you tell them to do? I'll let you go first, Madison.
Well, I'll reassure people that participation in a syringe services program in Indiana is completely anonymous. So we're not getting your name, your date of birth, your social security number, anything like that. All we really care about is that you bring yourself, and we're going to give you whatever you need. We're going to do it without judgment. The primary.
Right. And you don't even ask their name, right? So you don't do that at all. Is that right?
Well, there's a little complicated answer on that
Okay.
people get thrown off on. So to generate an ID for you to be able to have an ID card to be recognized by law enforcement and for our data collection purposes, we do generate an alphanumeric jumble that's always like KK07 extensively. But to do that, we ask for the first initial of your first name, the first initial of your last name, first initial of your mom's name, first initial of your mother's maiden name, and a few other things. So your initials will be collected.
Your initials will be collected, but people don't have to feel like they could be, turned into the legal system or worry about anything like that.
No, there is no communication between the Syringe Services Program and its participants and with law enforcement agencies, CPS, anything like that. We work collaboratively with law enforcement to make sure that we have a good relationship so that law enforcement will treat our clients with respect and recognize that they are participants in a legal syringe services program.
Anything you'd add to that?
Harm reduction at Damien is very much the same, where we don't ask or collect any of that information either. And I really would want to assure folks that visit our harm reduction specialist here, that even if you get medical services here, even if you get HIV case management or anything else, none of that information is given to us. So you will not be connected in any way, shape, or form in any documented stuff.
So, and what you mean is that if they come in and get enrolled in the clinic to get treatment, the clinic will have to collect information for their medical record, but that does not, none of that information is connected to the harm reduction team, so you can't possibly turn over any information. And the clinic may not even know that the information that you have at all in terms of the client or patient.
Yeah, we collect information based on demographics. We may ask you what zip code you live in, but that's really about it. And that's just so we can make sure that we're helping as many folks as we can.
Yeah. So one of the things we often get asked is there any way for a group to volunteer or help out? Is there any way for somebody to volunteer or help out with your program?
Absolutely. We have events here during the day for kit making, because we have, like I mentioned earlier, we have the safer injection kits and smoking, snorting, safer sex kits. We love getting groups to come help us put those together, because that can be pretty time consuming. We also need help sometimes staffing our non-syringe harm reduction room, just making sure our supplies get out to the folks that want them.
How about you, Madison? Do you also have opportunities?
We don't right now. Sometimes we'll do community cleanups though, where we're going out. The last one we did, we actually collected 200 bags of trash and only found 2 syringes in the community.
All right.
So, and the media found them, so I'm not entirely convinced. But
well, because that is another myth, right? I mean, if you think about it, there's this myth that if you're doing a syringe exchange, that means there are going to be more syringes just laying around the neighborhood, and you find that's not true.
That's not true. People discard their syringes because they're afraid of the police, they're afraid of getting caught with syringes. And by providing our program participants with sharps containers, which I know that you guys do as well, to be able to safely dispose of those, they have, for the first time often, a very easy way to dispose of their syringes. And we collect syringes from anybody in the community, not just our participants.
Yeah, and a sharps container, if people don't know what that is, it's a safe way to put a needle in, and it won't stick you or anything, and they can just carry they're little small containers, right, that you can carry around and use, and then they can come here and drop them off to us and they get a new one, right? That's how it works, right? Yeah. So that's exciting. So going forward, what are any new things you want to be doing? What would you love to see your programs evolve into? I'll start with you, Madison.
So we're working on, we got CDC funding to create a health hub very similar to what Damien Center is doing, where we'll have all of our services in one place, where people can get linked to hepatitis C treatment, to PrEP and social work, and covering kids and families for insurance enrollment, all in one place. That's something that we're hoping to do this fall. Very excited to do that.
Do you know where you're going to be opening that yet, or?
Our location just changed.
Oh, it's okay. You don't have to tell us if you're not sure.
I'm gonna keep it secret.
Yeah, that is fine. Well, we'll maybe have you back when you get there, and we can talk more about how that's going later. How about for the program here? What are some of your plans, your hopes? Where would you like to see it evolve?
Sure. The biggest new thing coming up is our SSP that'll be starting within the next couple months. And just really...
And SSP, again, just so people know, that is Safe Syringe Program, and that is the actual distribution of clean needles to people, so that again, they can have safe injection. And right now, we don't do that, but we're in the process of having an agreement worked out with the health department so that we can actually do that, hopefully within the next couple months. Yeah.
And just really spreading the word about harm reduction and letting folks in our community know what we have to offer, and that they can come here for a lot of things now, not just HIV.
And when can we, you mentioned one of the exciting things was the hepatitis C patients being able to get into the medical care here. When will that start, and when can someone come here, as you mentioned, to see the health navigator and get insurance, get other kinds of supportive services? What's the timeline on those things?
Really soon, actually. Starting, I believe it's August 23rd, Ray, our health navigator, will begin seeing their first patients and completing the health navigation intakes and getting them scheduled for the labs and clinic appointments. So by end of September, we'll have folks in the clinic being treated.
Excellent. And if people want to self-refer themselves, can they do that on the website? Can they do that? Do they call you? Do they come in person? How can they get involved?
A lot of different ways. Clicking on us on the website, they can get to, we try not to collect too much information on there, just so we make sure that everybody's info stays nice and safe. So calling either myself or anybody in harm reduction at Damien can get them to the right place, or just calling the clinic front desk. Okay. They'll also be able to get them to us.
And don't we have hours where people can walk in and get harm reduction kits and get information? What are those kinds of hours? And tell us about that area.
Absolutely. So we have a harm reduction room on the main floor of Damien. It's right off the lobby, super easy to access. Anybody is welcome to come. Anytime the building is open, we make sure that we are available.
Great. Well, always look on the building. You can look on the website or on the building for the hours. So check that out before you come, but it's usually available. And I just want to say thank you, Madison, for joining me today. Thank you, Carrie. I'm really excited about the work both of you are doing. I think it's a really tough, important thing to be doing in our community. And so keep up the great work, and thanks for collaborating with us, and thanks for heading up this brand new exciting area for us. If you are curious to know more, don't hesitate to reach out to us. You can always go to our website, that's damien.org, O-R-G. There you can sign up for volunteer opportunities. If you want to specifically do harm reduction, you can note that. There are many others. You can make a donation. You can find other ways to get involved, so check that out. I want to end by just saying, just reminding people, there's COVID is still a pandemic, so please make sure you're taking care of yourself. It is a simple vaccination. I'm vaccinated, you're vaccinated, I didn't have any side effects when I got mine. Did you guys have any minor anything?
My immune response was kicked in pretty good.
Was it? Okay.
Yeah, but that means it works.
That means it worked, yeah. All I had was a sore arm, so like it was very easy. Our rates of vaccination in central Indiana are not as high as they should be. So please, if you aren't vaccinated, think about it. Go talk to your friends, your family, encourage people to get vaccinated. That's what's gonna help us get back to normal. And as a reminder, wear your mask now if you're in a public place that you don't know. whether or not people have the vaccine. That's a new guidance that came out. So we encourage people to be safe for themselves, for their family, for their loved ones, and for anybody that they're working with. So take care. Thanks very much. And please join us again next month.